the administrator, Most Reverend Father Dr. Julius Ehikioya Eko, the acting provost in absentia, Mr. Celestine Olise, the registrar, Sir Idoni, the chief librarian, the bursar, all lecturers here present, our guests from First Bank, my wonderful students, ladies and gentlemen. I'm here this morning to discuss the topic, the evolving role of nurses in modern healthcare. A lecture delivered at the College of Nursing Sciences, St. Camillus Catholic Hospital, Uromi. The outline for presentation will be looking at the introduction, historic background of nursing globally and in Nigeria, the evolving role of the nurse in modern healthcare, the importance of this evolving role of the nurse, challenges, the way forward, and we will conclude. Introduction. Nursing, we all know, is an important profession that makes a crucial contribution to patient safety and high-quality healthcare. Nursing is one of the most dynamic and essential professions in modern healthcare. I know you agree with me on that. Traditionally, nurses were primarily viewed as caregivers who carried out physicians' instructions and provided bedside care to patients. The nursing profession has transformed dramatically from what it used to be to where we are today. The role of the nurse has evolved significantly over the years due to advances in medical science, shifts in disease patterns, technological innovations, globalization, healthcare reforms, and rising patient expectation. What is nursing? Nursing is a health profession that is dedicated to caring for people at all ages and different stages of life in all settings. By all settings, could be in the hospital, could be at the clinic, could be at the primary level, at the secondary or at the tertiary level. Nursing is both an art and a science because one, it combines compassionate patient care with scientific knowledge and technical skills. It's a science because knowledge is involved. You are looking at cognition. You are looking at the knowing, the comprehension, the knowledge. Why is an art? Because of the skills that is involved in the nursing profession. According to Florence Nightingale, nursing involves both caring and skilled observation, making it a profession that is grounded in humanity and science. Who is a nurse? A nurse is a trained healthcare professional who is registered and licensed to practice by the regulatory body or regulatory professional body that is domiciled in that country. In Nigeria, we have the Nursing and Midwifery Council of Nigeria. They are the body that regulates our activity, the intent of accreditation, and the different things that we do that pertain to nursing and midwifery. A nurse integrates scientific methods with observations of each patient's needs. Nurses promote health, help people prevent illness, and care for people who are ill, disabled, or dying. According to Virginia Henderson, the nurse is a healthcare professional whose unique function is to assist the individual, sick or well, in the performance of those activities, contributing to health or its recovery, or to a peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. So the care rendered by nurses goes beyond just vital signs or giving medication. You also assist the individual to promote health. You assist the individual to die a peaceful death if that person must die. If it's a condition that the person will not survive, they help the person to die a peaceful death. It's called dignity. There is also dignity in dying. So the person will die peacefully. So what is modern day healthcare? Modern day healthcare is a technological-driven, patient-centered system focusing on preventive, personalized care rather than just treating sicknesses. It integrates advanced diagnostic, digital tools like telemedicine and wearables, and AI to improve accessibility and health outcomes, aiming for overall physical and mental well-being of the individual. Looking at the historical background of nursing, so that when we are talking about the evolving role of the nurse, we'll know where we started from or where we are coming from and where we are now and where we want to be in the future. Before the mid-19th century, nursing was far from the esteemed profession we know today. It was often carried out by untrained individuals, family members, or religious sisters, and society generally viewed it as menial work. The profession lacked formal training, standardized practices, or professional recognition. No wonder when Florence Nightingale in 1844 wanted to pursue her career in nursing, her family, her wealthy family forbade her. They said no, nursing was not your thing. Why? Because it was so regarded to be very low. And I also remember myself when I gained admission to do midwifery at St. Camillus Hospital, 1986. And my elder sister just entered Zuma. She entered in March, I entered in September. And I remember one of my cousins asking me, why nursing? Your sister is doing nursing, you are doing nursing. Is it because it's very cheap? I cannot even imagine. And I was trying to explain. I said, cheap how? The admission did not just come like that. I read for it, I sat for the exam, and I passed. Then that one passed. Then I went for nursing. My sister also went for nursing. Another uncle of mine said, why are you all doing nursing? Is it because it's very cheap? Let me shock you. My uncle's daughter read microbiology and went to the US and checked from microbiology to nursing. The cheap course that he said I read or was reading is the same course that his own daughter, lovely daughter, went to the US. Even when she got it, there was no job for her as a microbiologist. So she now decided to switch. So when he told me, my daughter just graduated, my other sister was like, you didn't remind me that he said it was a cheap course. So nothing is not cheap, like the way people say. So everything changed during the Crimean War in the 1850s, when Florence Nightingale led a team of nurses to care for the wounded soldiers in Scutari, Turkey. Nightingale and her team encountered shocking conditions such as inadequate medicines, poor hygiene, no heating, and rampant infections. We know the temperature over there is very cold, and these soldiers were already wounded. There was no adequate lighting, no ventilation, nothing whatsoever. No standard precaution was taken. So Nightingale's systematic approach to care, emphasis on cleanliness and the use of data to track outcomes proved revolutionary. Imagine as far back as 80 something years ago, she was already looking at data. Her statistical analysis showed that mortality rate dropped from 60% to 2.2%. Let's clap for Florence Nightingale for this conference we are having this lecture today. Because of her intervention, she had a dream and she pursued that dream. And I want to ask for sitting looking at me. I hope you chose nursing as a calling, not because you were pressured by your parents to come and read nursing. Because otherwise, you are in the wrong profession. But if you chose it as a calling, you will pursue it to the end, and the sky is your starting point. So this evidence-based approach laid the groundwork for modern nursing practice that you and I are practicing today. Nightingale did not just care for patients. She documented her methods, analyzed outcomes, and proved that nursing interventions could save lives. Her book, Notes on Nursing, 1859, became a foundational text that distinguished nursing knowledge from medical knowledge. So the birth of formal nursing education. Nightingale's most enduring contribution came in 1860 when she established what many consider the world's first professional nursing school at St. Thomas Hospital in London. The Nightingale Training School for Nurses introduced a structured curriculum that combined theoretical knowledge with practical clinical experience. By the early 20th century, hospital-based training programs had begun. That was the type I went through at St. Camillus. You are called apprenticeship kind of nursing. You are there. We didn't have it the way you are having it now. You are in class, then when class is over, you go for clinical posting. No. From 9 duty, I will go and write exam. From 9 duty, I will go to class for lectures. So we are combining the two. There was nothing like block class work, then clinical posting. That's historical background of nursing in Nigeria. We're looking at the global context, but now back to our own home. The history of nursing in Nigeria reflects the development of healthcare services from the pre-colonial era to modern professional nursing practice. Nursing in Nigeria has evolved from traditional methods of caring for the sick to a well-organized and regulated profession with specialized fields, educational institutions, professional associations, and legal frameworks. So we're looking at different eras. At the pre-colonial era of nursing in Nigeria, what happened? Care for the sick was mainly by TDAs, traditional healers, herbalists, etc. The methods used in rendering care were through herbal treatments, spiritual healing, massage, both setting, traditional childbirth practices, and so on. Care was based on cultural beliefs, customs, and indigenous knowledge, passed from one generation to the other. Is this woman that circumcised my son? Is this woman that took my delivery? She will take my daughter's delivery. So, and when she's old, she will teach her own daughter or her daughter-in-law. So it became a family or a tradition that was passed from one family or from one generation to the other. Then we want to look at the missionary era of nursing in Nigeria. The modern history of nursing in Nigeria began with the arrival of Christian missionaries in the 19th century. The missionaries established hospitals, clinics, maternity homes, and schools of nursing. Their aim was not only to provide healthcare but also to support evangelism and community development. So the colonial era and development of formal nursing education. During British colonial rule, healthcare services expanded rapidly. The colonial government established hospitals in major cities like Lagos, Enugu, Ibadan, and Kaduna, and this created needs for trained nurses. The beginning of formal nursing education in Nigeria. Formal nursing education in Nigeria started in the 1930s and 40s. One of the earliest formal schools of nursing in Nigeria was established at the General Hospital, Lagos. The establishment of University College Hospital in Ibadan significantly improved nursing education standards in Nigeria, and it became a major hub for professional nursing training. No wonder today, when we go to conferences, all the professors we see, very young ones, they are all from that side. Why? They were the ones that had these schools, and they had the privilege and the opportunity to utilize what they have, unlike those of us from this other side. Post-independence development of nursing. After Nigeria gained independence in 1960, there was a rapid expansion in healthcare and nursing education. More schools of nursing, schools of midwifery, and post-basic nursing programs were established across the country. Nigerians gradually replaced expatriate nurses in clinical practice, nursing administration, and nursing education. This promoted indigenous leadership in nursing. So this led to the establishment of a regulatory body like the Nursing and Midwifery Council of Nigeria, which was established in 1979 by Decree number 89, now Act Cap 143, Laws of the Federation of Nigeria, that was amended in 2004. So before now, we had the Nursing Council of Nigeria and we had the Midwives Board of Nigeria. But they were now merged together to become Nursing and Midwifery Council of Nigeria. And they regulate registration, accreditation, they conduct professional examination, and they maintain training standards. So development of university-based nursing education. The advancement in healthcare created a need for higher nursing education. Universities began offering Bachelor of Nursing Science degrees. This also boosted the entry requirements to 5 credit passes in physics, chemistry, maths, biology, English language, and chemistry. Historical overview of nursing rules. We want to see how the nursing rules now evolved from the traditional method. In the past, nurses were often regarded as subservient healthcare workers with limited autonomy in decision making. They were subordinates to the other healthcare givers, especially the physicians. Nursing focused mainly on assisting physicians, supplying their needs, such as holding water for them to wash their hands, giving them towel to dry their hands, holding the chart for them to write on. Those were some of the duties our nurses were carrying out then. Then they were doing basic bedside care like bed making, tepesponging, etc. They comfort patients, maintain hygiene, administer medications, and monitor vital signs. So, what is now the role of the nurse in the modern day healthcare? We want to look at the evolving role of the nurse. Several interconnected factors continue to drive nursing evolution in Nigeria and the world at large. Societal health needs constantly change as population age, chronic diseases become more prevalent, and new health challenges emerge. In this jet age, a lot of things are going on in our environment. Things are changing. There is air pollution, there is increase in population, there is actually population explosion, and this comes with other things. As people are increasing the number of vehicles people are driving are also increasing. A lot of things are going on, and this is also affecting our health. Westernization, copying the white man's way of life, eating processed food instead of the natural one our parents were eating before, mushroom and locust bean seed and the rest of them. All those have faded away, and this indirectly has or directly affected the health of the people in our society. So because of this, also our care need to change. We have to move with time. We don't have to remain where we are. So we have to let go the traditional method and adopt the modern method. So medical and technological advancements create opportunities for nurses to take a new responsibility, and use sophisticated tools in patient care. What are some of these sophisticated tools? Healthcare technological integration, use of telemedicine, smartphone apps, and wearable devices for remote monitoring and virtual doctor visits. We have telemedicine. There is a clinic in Ekpo, my primary healthcare center in Ekpo, where they consult every Wednesday. The doctor is in the US, California. He sees patients in Ekpo every Wednesday. It's telemedicine. It's virtual. That is technology. Then there are different things. You can have your wristwatch on your hand. It tells you. A student which the wristwatch told him, you have not rested. That his rest hour has reduced because he was preparing for exam. So you need to take time out and rest. That's technology. Your sphygmomanometer, it used to be mercury manual. We are now having digital. All these are technology. So you can put it in your wrist, you can tie it, so you can check your blood pressure by yourself at home. What of the glucometer? Before now you go to the lab to check your glucose level, but you can do it at the comfort of your home. All these are technological driven. All these are changes in our care, and has also made care easier and faster. A patient comes to you and says an emergency. You are a unit. The first thing you do, check with the multi-parameter monitor. You check. You can tell with the pulse oximeter, the SpO2. You can tell the pulse rate. You can tell the temperature. You can tell the blood pressure. While you are doing that, another one is checking the blood glucose level. So at a glance, you already know the parameter of this person. You already know what is likely the problem. So you take it on from there. So nursing applications of wearable technology include guiding patient education, monitoring treatment adherence, and implementing timely interventions based on collected health data. Comprehensive well-being, defined by World Health Organization as complete physical, mental, and social well-being, not just the absence of disease. So digital health records is also part of it. We now use electronic medical records. You don't need to carry case notes. You don't need to carry files. So the hospital does not even need to look for space. With your tablet, with your phone, you can access with patient ID, access patient information wherever you are. Then minimally invasive procedures. Yes, before now we are doing traditional surgery. A patient will do laparotomy. Laparotomy, the patient will take the patient like 1 week, 2 weeks to leave the hospital. The big sky is there. But now with laparoscopy, you can carry out the same procedure. And it's called minimal invasive surgery because the incision is a pinhole incision. The individual can go home the same day or the next day. The blood loss, where in the traditional surgery you can have up to 1 liter, 1,000 ml of blood. This This one you can have just like 15 minutes or 100 minutes maximum. So recovery rate is faster for the patient, and the patient will spend less money and less time in the hospital. Then nursing as a profession is involved in identifying its own unique body of knowledge essential to nursing practice. So to identify this knowledge base, nurses must develop and recognize concepts and theories that are specific to nursing. So as nursing role is evolving, nurses should also learn to develop theories, because in the theories, the concept that guide your practice. Like we have the Dorothea Orem's theory of self-care nursing. Then you have the Henderson needs theory. You have Sister Calista Roy's adaptation theory. You have Edgar Kepler that's talking about interpersonal relationship in nursing, and so on and so forth. So you can also develop your theory based on what is available in your environment. The evolving role has transformed nursing into a highly specialized and intellectually demanding profession that contributes significantly to healthcare delivery worldwide. The nursing profession has transformed dramatically over the decades. So what once centered primarily on bedside care now has evolved into a dynamic field where nurses serve as autonomous practitioners, leaders, specialists across diverse healthcare settings. Today's nurses are equipped with advanced education and training that allows them to take on responsibilities that extend far beyond traditional nursing duties, addressing critical gaps in healthcare access and quality. Nurses have gone beyond the traditional method. As we go on, we see nurses can now prescribe. They can take on roles independently. Nurses have collaborative role and they have independent role that they can carry out. That takes us to nursing care through the utilization of nursing process. We all know the nursing process, and it allows nurses to carry out both independent and collaborative nursing care. There are independent nursing care that you can carry on. Before now you cannot. So it's annoying when you are on the ward, a patient's temperature is reading 38 degrees. Instead of you to take his phone, you are looking for a doctor. It shows you don't know what you are doing. As a nurse, tepisponging is an independent nursing role. You don't need it to be prescribed. Monitoring of vital signs is an independent nursing role. It should not be prescribed by the doctor. I was in Africa and the doctor wrote after surgery, monitor vital signs for and I told him no. You don't have to prescribe my role for me. I am a nurse, and I know that after surgery, I should monitor the vital signs quarterly for the first 2 hours, then 30 minutes for another 1 or 2 hours, then interval will increase. And he was like, where are you trained? And if you don't write it here, they say it was not documented. We should not give up what is our own. These are independent food that you can carry out by yourself. You don't need anybody to prescribe it. You should tepisponge, check again. It's when the temperature refuses to go down. After you have tepisponged, you have exposed to fire, you have given cold drink, you have opened the windows, and the temperature is still where it is, so it's getting higher. That is when you write for the doctor to come and see. Not when you are not tepisponged. The doctor is not writing, prescribing, tepisponge. So please, let's know our place in nursing. The diversity of modern nursing roles extends well beyond advanced practice positions. Today's nurses work in clinical settings, ranging from intensive care units to outpatient clinics, in educational institutions, preparing the next generation of nurses, in community health centers, addressing population health needs, and in research facilities, advancing nursing science. So what we are saying is that as nurses, we are looking at the evolving role. Today, nurses not only do bedside, but they also do nurturing work. They are in education, they are researchers. They research because we need evidence-based nursing practices. And we need people to carry out this research so before we can apply whatever findings we get in our research in our day-to-day nursing care and practices. Nurses are there in the community attending to other issues. So we have all sorts of specialties of nursing. Some nurses specialize in informatics. An example is Dr. Eleke. Dr. Eleke is from the Department of Nursing. He said himself and his students have developed an app, and we want you to look at it after now. It's called Abdella. Abdella, that's the name of the app. Check your phone, you will see it. It's going to help you as students with your research and your academic work. As soon as you enter, you will see the name of the student who developed it. This is informatics. This Dr. Eleke is a nurse, but is now into technology. So who says a nurse cannot also diversify? So other focuses on quality improvement, working to enhance safety and outcome across entire healthcare organization. Nurse educators shape curricula and mentor students, while nurse researchers investigate questions that advance evidence-based practice. The professional diversification reflects nursing's maturation as a discipline. Nursing has matured and is still maturing as a discipline. Modern nursing is not just about following orders or completing tasks. It is about applying specialized knowledge, exercising clinical judgment, and contributing to healthcare innovation at every level. Nurses now hold masters or doctoral degrees and possess specialized knowledge that bridges the gap between nursing and medical care. This evolution reflects healthcare's recognition that nurses with proper education and training can deliver comprehensive, high-quality care independently. So we want to look at evolution of specialized nursing roles in Nigeria. What are those specialties? Especially post-basic nursing specialty. Thank God that Nursing Admission Council is trying to make it at the master's level. So you want to specialize in post-basic nursing, you now take it at the master's level. So modern healthcare demands have led to specialization in nursing. Post-basic nursing institutions were created to train specialist nurses. These are also areas. Examples we have pediatric nursing, psychiatric nursing, perioperative nursing, accident and emergency nursing, intensive care nursing. So take note, these are areas that you can diversify into after your nursing education. Public health nursing, orthopedic nursing, ophthalmic nursing, nephrology nursing, cardiothoracic nursing, neonatology nursing, bones and plastic nursing, etc. So every aspect, every part of the human body, ophthalmology is also there. So you can specialize in all of these. All these are evolution. So modern trends in nursing in Nigeria. The role of the nurse has evolved to modern nursing in Nigeria, which now emphasizes evidence-based practice. It's no longer care as usual, care as before. There have to be evidence. You have to carry out investigation. You have to assess the patient. And that's where our nursing process comes in, where you do a thorough assessment using the Gordon-Manjoris functional health pattern, 11 functional health patterns. That will help you to assess the individual holistically. Once you have done that, then you come up with the cues you have identified, you make your diagnosis. And this diagnosis will now determine, are they for the ones that you handle independently or they need collaborative care. If it's the one that you can handle independently, then you go ahead, carry out your action plan, then you evaluate. If you have met your goal, you leave that and identify another problem on that patient and you carry out again your care. Remember that nursing process is a continuous process, always step by step and going from one condition to the other. Condition already settled, you leave that, you look for new ones. Patient is sweet to go home. Even upon discharge, you now make wellness diagnosis or health promotion diagnosis. Then nursing informatics or information technology is also another area. It's a new trend in nursing. I just told us about Dr. Eleke Chinemerem. He's a nurse who is now into technology. The advanced nursing education, taking your career beyond just basic RON, going further. Research and innovation is very important. Nurses shy away from research, but there's no way you can do without research. Research is interesting if you are really involved and you want to be into it. Socialized healthcare services, community-based healthcare, nurse entrepreneurship. This is a new one that has been introduced, and I'm aware that St. have launched their own. That as a nurse, you can still be a tailor and be a good nurse. You can be a nurse and be a beautician. You can be a nurse and be a photographer. You can be a nurse and you are the one producing hand sanitizer, methylated spirit, sodium hypochlorite, etc. that you supply to other hospitals. You are not waiting for just your monthly salary. Then the advanced practice nurse. Advanced nursing practice is defined as career pathway. This is a recent one. The Nursing and Midwifery Council is looking at it right now, and they are trying to see if they can have some hospitals that they will use to experiment. Then they will now pass it on to the others. What do these people do? Who is an advanced nurse practitioner? Is defined as career pathway for nurses committed to professional development and practice at a higher quality level of capability as autonomous expert practitioners. This is defined by ICM 2011. They have the authority to perform tasks beyond the registered nurse scope and often function similarly to physicians, consulting, performing assessments, diagnosing conditions, and prescribing medications. Well, how do I put it? We're already having challenges from our sister and our brother profession. But the fear is their work will be taken from them if a nurse. But they are forgetting that there are some areas that have not been reached, underserved areas in this country, where some of them don't want to function. So as an advanced practice nurse, you can prescribe, you can treat a patient up to discharge. In Nigeria we are having these issues. In developed countries, it's not like that. My daughter delivered in December. I was in UK. I went with her to the clinic. The number of times we went to the clinic, it was a nurses that we met. Never the visit a doctor. It's the nurses that will assess. They will prescribe, and you go home. Before you see a doctor, it has to be a very serious condition. But here we are limited because of our belief, because of our culture. I don't know, or maybe we are myopic in our reasoning, so to speak. But this one, we pray that we will have a breakthrough with this, so that nurses can go beyond where it is, where you have the authority to prescribe and treat. So the nurse practitioner. A nurse practitioner represents one of the most widely recognized expanded nursing roles. These professionals complete graduate level education and obtain advanced practice certificates. What are their roles? Their roles are to order or interpret diagnostic tests. They can diagnose conditions and they can prescribe medications. In developed countries, nurses are the ones that will do ECG. ECG there you prescribe it. ECG there the machine is there. As the patient is coming, you do the ECG. You should be able to interpret the different waves to know if the heart is beating as it's supposed. Is there anything wrong with the reading? You should be able to come up with that. Then you know the next line of action to take. So nurse practitioners can evaluate patients, diagnose health problems, order tests, and manage treatment plans independently. Nurse clinician role. Nurse clinicians emerge from the recognition that experienced nurses develop specialized skills through consistent care of specific patient populations. Now you want to ask the advanced nurse practitioner, the nurse clinician role. There are two different things. One can treat all conditions, which is the advanced nurse practitioner, while the clinician is like a specialist in a particular area. You can be a neonatologist, you can be an ophthalmologist. So it's that area that you also manage, and you are also allowed to prescribe. You are also allowed to treat this patient from start to finish. So what are the factors responsible for role evolution in nursing? These developments created the need for nurses to acquire broader knowledge, critical thinking skills, leadership abilities, and specialized competencies. Several factors contributed to the expansion of nursing roles, and they are advances in medical technology, increased healthcare needs of population, emergence of chronic diseases, global health challenges, and pandemics. Like the last time we had the COVID-19 pandemic, the shortage of physicians. You agree with me that we have shortage of physicians. One consultant is attending to 50-60 patients. So where nurses can actually also assist in seeing some of these patients and to reduce the burden on everyone. Higher educational preparation for nurses, evidence-based practice, health policy reforms, increased awareness of patient rights. Nigerian government, they have signed a patient's bill of rights. But unfortunately, a lot of things are allowed to or are swept under the carpet in this country. Developed countries where they have serious litigation issues, nurses are on their toes every day. So because of that, everybody is aware and our roles evolve. You go to school, you want to learn more, you want to know more, you want to be abreast of what you are supposed to do and how you go about it. The expansion of specialized healthcare services. Other roles of nurses. Nurses serve as health promoter, patient advocate, educator, counselor. They are collaborators. They also serve in the area of telemedicine and informatics. What is the importance of the evolving role of the nurse or nurses? It improves quality of patient care. It increases access to healthcare services. It promotes disease prevention and health promotion. It enhances patient safety. It supports healthcare delivery in underserved areas. And it encourages professional growth and specialization. What are the challenges facing modern nurses? Despite their proven effectiveness, nurses in expanded roles still face barriers. Regulatory restrictions is one of them. In some areas, in some jurisdictions, there is limits in the scope to which the nurse can practice. I think Nigeria is one of such. The reimbursement policies may not fully recognize their services. If you are not getting wages for the services you are rendering, then that becomes a challenge. Professional resistance and limited public awareness of advanced nursing capabilities can pose obstacles. Yes, when we say professional, it could be other healthcare professional, it could even be an internal one, your own colleague, your own a co-nurse. So now she's the one that will not be prescribing. Then me, I'm the one that will administer. So which school did she go to? That's a problem on her. And we should learn to deal with this. We should accept changes and not look down on people. So the aging population and rising prevalence of chronic diseases create sustained demand for nurses with advanced skills. The population, as it's growing, and there is rising prevalence of chronic diseases. For example, we have diabetic mellitus, we have hypertension, etc. All this puts more demand for nurses with these advanced skills. So back here, some of these roles we are looking at, we have not started implementing them, but in developed countries they have implemented. And I know more than half of the nurses that are Australian nurses looking at me here, you are not going to remain in this country. I'm not the one saying it, it's a system. I know you will not remain. Everybody is going for greener pasture. So challenges facing modern nurses. Shortage of nurses is a problem. We may have the ones that have graduated, but are they employed? Are they gainfully employed? So if you are not gainfully employed, then it's considered that there is shortage. Because we are looking at those who are in the hospital right now, not the ones that have graduated who have not been employed that are at home. The poor remuneration, when you are not being paid how the way you should have been compared to other healthcare professionals. The poor working condition, nothing to work with. You don't have a functional sphygmomanometer. There is no multi-parameter monitor in your ward, because most people don't use traditional swivel manometer. You fix the multi-parameter, you time it for a critically ill patient, and it treats. If it's every 15 minutes, it will check, and your own is to go and document. So then now you have to go and check, and it's an issue. Then limited funding. This has been an issue in the country. Generally, the funding of the health sector is far below what is supposed to be. Then professional challenges. I already mentioned it. Within the nursing profession itself and the other healthcare professionals. Then what's the way forward? The way forward is to strengthen the profession, better funding, improved working conditions for workers, more training opportunities for nurses, stronger healthcare policies that will support these evolving roles that we are looking at. Then retention of skilled nurses that are skilled should be retained instead of allowing them to go. What's the future of nursing in Nigeria? The future of nursing in Nigeria is promising due to expansion of nursing education. You can agree with me that we have a lot of nursing schools right now. So the issue of training is no longer a problem. At least almost every, I don't want to say community or local government area, in Edo State alone, the universities offering nursing, the colleges of nursing around us, there are many, and that's like this in every state. Thanks to Alhaji Farouk Omar, the immediate past registrar of the Nursing and Midwifery Council of Nigeria, who had the foresight of it. Then increased demand for healthcare services. So because of this increased demand for healthcare services, there should be increased training of healthcare professionals to give this care to those who need it. Then technological advancement. I will encourage us to be part of this, delve into this. While you are in nurse, look beyond nursing and see how you cannot just be good on your phone only to chat, TikTok, WhatsApp, what's the other one, Instagram, IG handle, is Facebook. No, let it go beyond that. I told us a student created an app that you can use for your research and everything. So please register and use it. Registration is free. It's called Abdella. I remember Abdella. Abdella is one of the theorists that we have. She's a nursing theorist, so they decided to use that name. Then greater recognition for nurses' role. So, conclusion. Today, nurses are not only caregivers, but also educators, advocates, researchers, leaders, policy makers, managers, and collaborators within multidisciplinary healthcare teams. The modern nurse plays a critical role in promoting health, preventing disease, restoring wellness, and improving the quality of life of individuals, families, and communities. The evolving role of the nurse cannot be overemphasized. The nurse role is evolving every day, and I'm sure more will come up. And at your level, you also give us more roles that will put us on our feet and make us to give our best to our patients. Remember that at the end of the day, the goal is to have a positive patient outcome. Great Nigerian students, thank you for listening.